Parkinson's disease is a serious disease of the brain that has no cure, tends to get worse with time, and can affect a lot of work-related abilities. So if you have Parkinson's disease, that's unfortunate. However, there's a very good chance that you would be approved for disability benefits, and I'm going to talk about Parkinson's disease in this video. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams. I've done over 1,500, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, Parkinson's disease is what's known as a neurodegenerative disease, which means that part of the brain sort of stops working or actually falls apart. And the main area affected is an area deep in the brain called the substantia nigra, which is a fancy Latin term for black stuff. And the reason it's called that is because unlike most of the brain, which is grayish-white, the substantia nigra is black. And in Parkinson's disease, the substantia nigra loses its black color as it degenerates. And the hallmark of Parkinson's disease is tremor, which means shaking of the body. Parkinson's disease symptoms are divided into motor, which means movement problems, and non-motor, which are problems not related to movement that can occur in Parkinson's disease. So the disease comes on gradually. It's more common in men than women, although it can occur in women. And it usually comes on over age 60, although it can come on younger. There is a family tendency, and other things associated with Parkinson's disease include repeated head trauma. The great boxer Muhammad Ali developed Parkinson's disease, and he had his earliest symptoms at age 38. And also exposure to some poisons, such as some pesticides and trichloroethane. Also, some medications can cause Parkinson's disease symptoms. Classically, the first generation of antipsychotics, the first medicines developed for people with schizophrenia, caused fairly severe Parkinson's symptoms. The newer antipsychotics have much less of a Parkinson's effect. The hallmark of Parkinson's disease is the tremor, and this is what's called a resting tremor. It occurs when the person is resting the body part. When they want to move the body part, the tremor goes away or diminishes substantially. And in the hands, it's called a pill rolling tremor, and it looks like this. And what will happen is you'll be talking to a patient and they'll be paying attention to you and not paying attention to their hands, and you'll see their hands start to shake just like that. And then if you ask them to do something like pick up a pencil, the tremor will stop. Since the tremor occurs while resting, that's not such a problem for work. But the other motor symptoms are, and they include rigidity. The muscle tone is increased, and the people feel stiff if you try to move their limbs. The other is difficulty with large movements. Their movements tend to become small, and the people have difficulty starting their movements and may have difficulty stopping as well. For example, the people with Parkinson's also often exhibit what's called micrographia. Their handwriting becomes extremely small. Movements tend to slow down. Another motor problem is difficulty walking. Patients with Parkinson's disease tend to take small, shuffling steps and have difficulty starting walking and may have difficulty stopping once they get going. They also tend to walk with a hunched over, stooped posture. They have great difficulty with large flowing movements, such as you might want to do if you were ballroom dancing or conducting an orchestra. The movement problems often create postural instability. They have trouble standing up and balancing, and falls are very common in Parkinson's patients. Anyone who has falls has a significant work-related limitation. If you fall easily, you can't, for example, work on roofs, ladders, scaffolds, or with dangerous machinery. In terms of the non-motor problems that can occur with Parkinson's disease, first are problems with thinking. People may develop hallucinations or delusions, false beliefs. They may have problems with anxiety or depression or apathy, where they don't seem to be moved by much. There can develop problems with behavior, sleep, and sensation, especially the sensation of smell. Often patients lose their sensation of smell. And finally, some, but not all, patients with Parkinson's disease develop dementia, where patients lose their memory and their ability to think clearly, and that would obviously be very disabling. Parkinson's disease is usually treated with medication, although in some cases surgery is done. And the medications have some side effects that can interfere with the ability to work. And keep in mind, if you're prescribed medication and the medication has side effects that interfere with your ability to work, that counts as part of your disability, and you should mention it to Social Security and your examining doctor. I think a lot of people don't understand that. Some of the medicines used for Parkinson's disease have a weird side effect where the patients become impulsive, and they may impulsively gamble, spend too much money, eat too much, or be too sexually active. Again, you can see how disabling that would be and how difficult it would be to hold a job if you were experiencing those effects. Now, Parkinson's disease is in Social Security's listing of impairments, and I'll provide a link to the listing in the description to this video below. Basically, to qualify for a Parkinson's disease disability, first, you have to have been on medication for Parkinson's disease for at least 3 months. And I've never seen a patient with Parkinson's who wasn't on medication, so that requirement should be easy to satisfy. And then you have to have either significant motor problems or significant non-motor problems. For motor problems, they say significant problems with at least 2 extremities, which means 2 arms or 2 legs or 1 arm and 1 leg. Again, Parkinson's disease affects the whole body, so that shouldn't be that difficult to meet. Or there should be significant difficulty rising from a seated position or balancing while standing or walking. For the non-motor qualification, there have to be significant limitations in memory and cognition, which is thinking, social interaction, which is getting along with other people, concentration and persistence, which is staying focused and on task, or adapting and managing self, which means taking care of yourself. Just one of those abilities has to be significantly impaired. I don't see a great number of Parkinson's patients when I do exams, but I certainly do see them from time to time, and in most cases, they definitely qualify for Social Security disability benefits. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.